This meeting is now being recorded.
Great. So again, thanks so much to everyone for joining us. As always, you should be seeing a nature scene, perhaps a tree right now. When we pull up the presentation in just a couple of moments, you should be seeing those slides. If you're having any trouble with any technical aspects, feel free to either click the arrow next to the CLPHA host name and you can send me a private chat so I can assist you, or you can also send me an email and I can try to troubleshoot with you that way. Of course, always let Cassie or I know if you're having any problems after the fact, anything you'd like to share with us about the webinar software. So I've gone ahead and put everyone on mute. So if you have a question, you can use the Q&A section. So that's either the two little chat bubbles on the top upper right hand of the screen. They say Q&A below them. If you click on that, you can go ahead and type your question in there at any time during the presentation, so you don't have to feel like you have to remember it. And you can either choose to display that question publicly or privately. And Cassie and I will go ahead and monitor to make sure your question gets answered. You can also choose to use the public chat section in the bottom left-hand corner of the screen. So it's really up to you, your preference of how you'd like to type in your questions that you have. Today, we have one presenter, but she has a wealth of information to share. But we will be doing our same format with having her present and then do questions after. But again, feel free to type those questions in at any time. And Cassie, did you want to go ahead and introduce Marsha? Do you want me to do it?
You can go ahead. I mean, I guess I would just say I had the opportunity to meet Marsha at the Education Summit, and it was really exciting, and I'm excited to hear more about, to have her have more time to sort of educate and speak to early learning. So I'm very excited, so thanks.
Great. Yeah, I'll just add that Marsha is with the U.S. Department of Health and Human Services, and I'll let her give a little bit more information about her background and her areas of expertise, but she primarily focuses on early learning with a special emphasis on children that are experiencing homelessness. And so we're excited to hear more from her about what's going on in Health and Human Services Department and ways that as housing authorities you all can possibly be involved in supporting some of those efforts. So Marsha, are you there?
I am. Can you hear me?
Yes, we can hear you.
Because I don't see this. There we go. You're good. So thank you so much. I'm actually very excited to be able to be on this webinar and to talk with you. And I did have the opportunity last week to get to meet Cassie and Abra and to talk a little bit about early childhood. And I will be honest with you, I want to be very candid and say it was my first entree in working with public housing authorities. And I left, my head was spinning, I was thrilled and so excited to really be able to talk with you today. So what I'm going to do is give you a little bit of background. As Abra said, I worked in the Office of the Deputy Assistant Secretary for Early Childhood Development at the Administration for Children and Families. Early childhood homelessness is one of the areas of my portfolio. I work on Race to the Top, Early Learning Challenge, and early childhood workforce and communications and a variety of other pieces. But I will say that the early childhood homelessness is the one that actually has a lot of my passion. So I am the co-chair of the Early Childhood Development and Education Work Group. That's part of the United States Interagency Council on Homelessness. And I have been doing this for about 3 years. So I wanted to put a little bit of background into the work that we are doing. And we have 4 goals. One was obviously to end all veterans and chronic homelessness. And now we're working on family and youth homelessness. Not that actually the others have been totally solved, but it's really important that we work on family homelessness. So I'm probably singing to the choir because you guys are on this webinar, and so you already know that early childhood is important. But this is really why this is in my portfolio. We strongly feel that if we miss that first 5 years of life, that we really have missed all of the foundation for early learning, and we don't want that to happen. So that's really why my focus is on early learning and why I want to encourage you all to work on early learning. We know the impact of homelessness on children. The impact, certainly, we've been looking at it since the mid-'80s on physical health, developmental status, mental health and behavior, and educational outcomes. And it's really why I work very closely with the McKinney-Vento office at the Department of Ed on early childhood, because we think that it really, if we can get it right in the beginning, first 5 years, then it will be, children will be much more successful in school later on. And I'm going to quickly go through my slides because I want to be able to answer questions. What you may or may not know is that the #1 time in America when a child is going to be homeless is in the first year of life. And I want to have you look at this slide very carefully. The graph shows that infancy is the period when a person is at highest risk of living in a homeless shelter. And, I think that that's somewhat shocking. The rates have fallen a little bit, fall a bit when children are 1, 2, 3, 4, and 5, although preschool children are much more likely than adults to find themselves in a shelter. And rates fall still further when children enter subsidized child care in the form of public schools. This is from the 2012 AHAR report, and yet what we have discovered each year is that it pretty much stays the same. This year, when AHAR came out, we still had more than 50% of all children in shelters were under the age of 5. So last week, I had a chance to actually talk with some of the large public housing authority folks at the symposium, and I think it's really important to put in perspective that early learning, housing, and education really need to think about the shared goals that we have, and that leadership and key personnel is extremely important, whether it's staff focused at a shelter, or staff focused at a housing authority, or staff focused on an early childhood program. Having people understand that it's really important to make sure that children have what they need and they are in a safe home. We have some promising programs and services, and it's really important to use data to make decisions. I have great anecdotal stories, but it's really important to use that data. And I think what's really important also is to understand that early learning is not the same as K-12. Oftentimes people think, well, just like kindergarten, if we think about pre-K, it's really just kids sitting in a smaller desk, and really it is very, very different. So some of the policy issues that we look at in early childhood education, and I'm going to talk a little bit about these through the webinar, are home visiting, access to high-quality child care, early Head Start and full-day comprehensive services, a brand-new program, Early Head Start Child Care Partnerships, which are cross-system, preschool development grants for 4-year-olds, family engagement, child services coordination and advocacy, the importance of developmental screening of infants and toddlers, health and safety issues, lead issues certainly have been very much in the news with Flint, Michigan, and early childhood data integration. So I want to mention that in the last few months, we came out with the very first early childhood homelessness in the United States, a 50-state profile. And we have a website that we can send you to, and it looks like this. It really, it does not have a huge amount of data, but it was the first time that we actually looked at the number of children by state that were experiencing homelessness. And then we looked at the number of children who were accessing Head Start and who were part of the McKinney-Vento data that was being collected by the Department of Ed. We really do hope that states are going to be using this, and the nice thing is that I've heard from communities, both from the early learning side and the housing side and the shelter side, that they are using this in their communities. And so I'm pleased to hear that. Some of the national findings are almost 6 million young children living below the federal poverty level in 2013. And yes, it is 2016, but when we came out with this, it was using the 2013 data. A lot of that has not changed. It's more than 1 in 4 children. We were able to get some data from HUD on children experiencing homelessness in emergency and transitional housing. I think what's really important is that, I now know that public housing authorities impact about 4 million children. And so, I think it's great for us to have a broader conversation around the number of children that together we can impact. One thing that we did learn in doing this exercise was that only less than 10,000 children are receiving CLPHA in homeless shelters, and that's something that we hope to work on. So if you sit on your COC, by all means, ask whether that happens. So my office, the Office of Early Childhood, really is responsible for the oversight of Head Start, Early Head Start, and child care. But I also work very closely with the Maternal, Infant, and Early Childhood Home Visiting Program, and the Tribal Home Visiting Program is run out of our office. And Head Start serves about 1.4 million children, about 1.1 million children yearly. It's a comprehensive 2-generational approach. Child care serves about 1.5 million children monthly, and over 60% of the families are living at or below the poverty line. So you probably have a large number of families in your housing that really access child care subsidies every month. The challenge is it is not an entitlement program. We estimate that only about 17% of federally eligible children receive subsidies. A low amount that we'd actually love to see grow. And then McVie home visiting programs match at-risk parents with trained professionals to provide them with information, advice, and support during pregnancy. And you may be working closely with home visitors in your community. We really believe that early childhood development programs play an important role in ending incidences of family homelessness through the community coordination, collaboration, and long-term partnerships. And, I think one of the questions that I want to ask, have you think about is, do you know who the early childhood people in your community are? And who are you in contact with? Are you aware of who runs the Head Start program? Do you know the DSS director who handles child care? Do you know who runs the home visiting programs? And, what I'd like to do and what I will share with Abra are some lists of some contacts so that everybody has this information. Sorry, I forgot to change this. In 2014, December of 2014, so for the last almost 18 months, we have been working on features of implementation for the Child Care Development Block Grant Reauthorization. This is the block grant that actually allows children to receive subsidy for child care, and there were huge changes to the law. It truly was a chance for states to be able to make a difference. What you'll see on this chart is some basic overview of what the reauthorization was, but the biggest impact for children and families who are low income and homeless are the 12-month eligibility policies. Prior to this, states actually could offer subsidy for a very short period of time. Now, because we really are focusing on continuity of care, it's important that when they receive a subsidy, it can last for 12 months. I don't know how many of you are aware, but it funds the CCDF in your state and in your local community, and every state has to submit a plan every 3 years, and the states just went through submitting a plan. Now, last week I heard a couple of people, I'm getting ahead of myself. Some of the procedures were, besides the 12-month eligibility policy, the good news is that now children who are homeless or at risk of homeless can really receive subsidy prior to completing all required documentation, so that there can be a grace period. One of the other things that really was raised was that there now has to be training and technical assistance on identifying and serving families who are experiencing homelessness, specific outreach, and then certainly coordination with programs working with children experiencing homelessness. So we're hoping that child care administrators will talk with housing authorities, will talk with continuum of care offices. One of the big takeaways was that it was to improve access for underserved populations, and so it required states to establish a new procedure for the enrollment of homeless children pending completion of documentation. It also talked about supply building. We know that we do not have enough high-quality child care, and so states really had to put in their plans that how they were going to develop increasing the supply of quality services for children in underserved areas. Certainly infants and toddlers, children with disabilities, and children in non-traditional care. So that's all part of the state plan. You may want to go on your state's website and actually look at what the state plans are. And we had the Child Care Development Fund notice out for public comment. It closed, but it defined homelessness, and we used the definition of homelessness, which is used by Head Start and the Department of Ed. It requires lead agencies to coordinate with other relevant agencies. So again, we're really hoping that lead agencies in child care are having conversations with our partners in housing authorities. And it clarifies that children experiencing homelessness can be given priority for services. Last week, I learned that that isn't always the case. And what I said to folks was, you know, it's now part of the law and that states can do that. And you need to go look at your state plan to see if your state plan prioritized children experiencing homelessness. If it didn't, then it's really a wonderful way to begin a conversation with the CCDF administrator, and state plans are amended once you have data to show and request preference. Head Start, really, and Head Start eligibility, it's children in foster care, children who are homeless, children in families receiving public assistance. They're all eligible for Head Start regardless of income. And the one thing about early Head Start is that if an infant gets into the early Head Start program, and we don't have a lot of early Head Start programs yet, but if an infant gets into an early Head Start program, the child remains eligible until they transition at the end of age 3 into the next program. So we also have standards out for public comment. And so some of the proposed standards, and maybe you saw them, maybe you didn't, I'm hoping that maybe you did. Someone once said that Head Start has more standards than anything else. And we did have about 420 or 450 standards. We've reduced them. We eliminated some redundancy. We streamlined the clarifications. We've strengthened some services for kids with disabilities. And we really improved services for homeless children. It again provides administrative flexibility so that if a family shows up and there's a slot and they are homeless, that their child can be put in, can be in a Head Start program. It, for the very first time, included homeless and at risk of homeless in community assessment. And all Head Start programs have to do a community assessment every 3 years. And the proposed standard also said that, should we have a set-aside of 3% of our slots that could be held for families experiencing homelessness. All of these were suggested. They were proposed standards. We are really hoping that by September, the proposed standards and the proposed regulations for the child care block grant are all out before the administration ends. So one of the things that I'd asked the Office of Head Start to do for me is to actually pull out some data so that I had a picture of trends of children who are experiencing homelessness and the number of families. And in 2007, when the Head Start Act was reauthorized, it made homeless children categorically eligible. Now, that doesn't mean you have to have spots available, but they were categorically eligible for Head Start. So in 2007, we had 26,200 children who were experiencing homelessness. And in 2014-15, we had 50,000. I mean, we had almost doubled that number since 2007. And, you know, the challenge is that you'll notice the number of families that found housing did not double. It still stayed somewhat lower. New last year was by Congress, Early Head Start Child Care Partnerships, and the goal was to expand the number of quality early learning opportunities for infants and toddlers. We hear an awful lot about pre-K, 4-year-olds, but, you know, we don't hear a whole heck of a lot about birth to 3, and that really is when we really want to make sure that children have the opportunity to learn. So we had 275 Early Head Start Child Care Partnership grantees that received funds. We had $500 million that we put out for applications, and 71.7% of the Early Head Start Child Care Partnership applications proposed serving homeless children. Of the applications that were actually funded, we had about 20% that really had an actual plan on working with both their continuum of care as well as their housing authority. So we hope that in the future we're going to see more services for families experiencing homelessness. One of the things that I work on in my office are also a lot of resources for the field, the early learning field. But we recently came out with an initiative called the Birth to 5 Watch Me Thrive initiative, and it's really about developmental screening. It talks about the importance of developmental milestones. Those of you who have children know that every single milestone is important, and we really want to celebrate those milestones. So there are definitions of screening and monitoring and surveillance. It's how to choose an appropriate tool, how to engage families and having them understand why we do this, and then how and where to refer if concerns are detected. We did a number of guides. It was mostly for the early care and education providers, and then we went to the early intervention, and we went to primary care providers, and while all of this was happening, I said, well, let's do a guide for housing and homeless shelter providers as well, because you have so many infants and toddlers that it really allows you the opportunity to be able to say to parents, has your child been screened, you know, for developmental milestones? And are you aware have you talked about this with your primary care physician? We also came out with a resource on building partnerships to address family homelessness. It was Head Start examples. One of the specific examples in the paper is really how Head Start partnered with Public Housing Authority. We also talked about how they partnered with emergency shelter providers and local education agencies, and I will be happy to share some of the links for where all of these materials are. The most recent resource that we came out with is the Early Childhood Self-Assessment Tool for Family Shelters. And it really was a tool mostly because when I had seen a number of shelters, although staff was doing a wonderful job, they weren't always the most appropriate environments for young children. And I wouldn't expect that the shelter staff would know that. That's my job, is the early childhood piece. And so I really developed a tool, a self-assessment tool that could be used with shelters and early childhood programs working together to really make shelters much more family-friendly and child-friendly. Right now, there are a number of states that are using this. Pennsylvania, actually, I don't know if anyone's on the call from Pennsylvania, but Pennsylvania is going to be rolling this out in a number of their shelters, and there's a research study that is going with this from the University of Delaware. and we're actually hoping to validate the tool for the future. It's been used in North Carolina, it's been used in Massachusetts, in Connecticut, and we're pleased with the response to it. It really was intended to help shelter staff to develop safe and appropriate places. There are lots of facilities that could use this, and so if you happen to sit on a continuum of care board or committee, ask them if they've seen the early childhood self-assessment tool for family shelters. It's used as an initial assessment. You can identify enhancement strategies, help develop an action plan, reassess at midpoint. I had a state, Connecticut, and a number of communities. I'm just giving you a little idea of what it looks like. This is programming. It had, as I mentioned, it has 5 different sections. There's one on health and safety, wellness and development, workforce standards and training, programming, and food and nutrition. And every one of them, it looks like this. But someone hopefully is going to say, well, how come some of it's in white and some of it's in blue? And I'll tell you that some of it, what's in white, is that you can probably do it without very little money. The light blue means that you probably need a little bit of an investment. And the dark blue is your shelter is just so good that it really needs to take it to the next level, and you need substantial resources. So we broke it up that way. And as an example on this page, you'll see that we put in links. We encourage support and family connection so that the person who's using this tool and sitting in a group and having a conversation around this does not have to go look and search for things. You literally have all of the links here that hopefully you would need. And I want to show the pictures a little bit from the work that we did in Connecticut. This was a lovely room where children would go to, and after working through the self-assessment tool with a Head Start program and meeting over an 18-month period, this is what the room ended up looking like. It did not take a lot of materials, but it was a matter of having the Head Start program work with the shelter, to rearrange the room, get some materials. Head Start was able to share some materials and really help in developing the space. I love this picture. And then, because the center, the shelter had really helped the child space, they wanted to build a family space, and so they were able to work with Bright Horizons and United Way, and they were able to create a family space in the shelter. One of the things that we have noticed in the communities, because we're trying to actually track it, is that children experiencing homelessness and their referral rate to Head Start nationally, you can see is the purple, the percent as homeless. In Connecticut, they've had such a connection now that the shelter knows exactly who to call, they have a relationship, and they've been able to get much more children into Head Start and early Head Start. So one of the things that I would love to have public housing authorities think about is to really help adapt this tool for public housing authorities. And then you'd have it available, and what you might do. So I kind of posted a few questions, but you don't have the tool in front of you, but we will send the tool out. And working to make services more family and child friendly, what areas of the tool could remain the same, but really what areas would need to be adapted for public housing, what needs to be added completely, because there's stuff in the shelter tool that really don't relate at all, and it needs to have a whole set of new resources, and then other resources needed to work with public housing authorities and early childhood together. So I'd love to have you think about that. If that's something that you might want to take on, I'd be happy to have some conversations around that. Last week, we actually talked a little bit about setting some early childhood priorities. The three that bubbled up, I actually had quite a list. I think we had about 17 by the time we were done. But the three that bubbled up were really to focus on supply, quality, and coordination. Coordination between the worlds. Someone had talked about advocating together. We tend to advocate for more dollars for early childhood. Housing tends to advocate for more dollars for housing. And wouldn't it be interesting to be able to have us come together to advocate together so that we actually had homes for families and services? Research to build awareness, and using the statewide Early Head Start Child Care Partnership grants as an opportunity. They're new in the community, and they really are ripe for being able to work with shelters and housing authorities. And we're going to be coming out probably by sometime next month, the end of the month, with a new grant. We have $135 million more dollars for grant opportunities for Early Head Start Child Care Partnership. We also talked a little bit about quality. And, the fact that it's not just babysitting and that early childhood programs really need to be high quality. So, you work with lots of people in your community. It's working with community colleges for courses and curriculum and training teachers. And then looking at restrictions on lockout arrival times in shelters, places for play, using the self-assessment tool, and coordination. That's one thing that we can all work on. What committees do you sit on? What advisory boards? Do you happen to sit on your state advisory committee on early care and education that advises the governor? Have you ever heard of the state advisory council that advises the governor on early childhood? It would be fabulous to have housing, at that table because we all need to work together to develop systems for collaboration and the ability to meet educational needs. Are you working with your school district in your local community, and do they understand the importance of early learning? Do they, stability, timing? And then one thing that really came up is that is there someone in your housing authority whose real focus is on children? Whether it's getting them into child care, helping the family get into Head Start, making sure that facilities are accessible. What is it that do you have someone that really focuses on that population? Last week, the Huffington Post ran an article on Clinton's child care plan could get very expensive and be totally worth it. It was driven by a candidate's plan regarding child care and paid leave, but I don't think it's a partisan issue because we did receive the $500 million for Early Head Start Child Care Partnership last year, and I think that children, the nice thing about children is that they keep being born, and so I don't believe it's partisan. But the column took a historic look, and it really explained how the United States never responded significantly to the extraordinary change in women in the workforce. So I think it's something that we can begin to think about from an economic standpoint. So I think I tried to get as much information in as I possibly could, but I think what I'd like to ask you to do is, because I went very quickly through all of these slides, I'd like you to take a minute to think about the existing and the potential resources in your community and how you might create some new relationships to ensure that young children experiencing homelessness or at risk of homelessness are being served. So I'll just give you a minute or two, and then if you're willing, I'd love to have you public chat, or I don't know if they can unmute, jot down a phrase or two to think about what your next steps might be.
This is Abra. So yeah, thanks Thanks so much to Marsha. Continue to take a couple minutes, but I also want to encourage you, if you have any questions, to please also submit those as well. But certainly, if I can take everyone off of mute. If you have strong feelings against that, just let me know. Thanks.
So I do have one question that came in. What is being done nationally and by the federal government to increase funding for homelessness, especially for families? I can tell you what we've done with early Head Start, Child Care Partnerships, Head Start, and Child Care. We don't focus on the actual housing, but I do work very closely with HUD. And so I think one of the, there was recently a 2017 budget that was submitted that was significant. I think that there are conversations around trying to get additional funds for housing for families. And then, but my organization's role is really then to make sure that not only is it housing, but are there services as well, because housing alone is not going to be the answer. You know, unless we have the services and the child care and Head Start and the other support services that are needed, we're not going to be able to make a dent in homelessness. So I don't know, Maria, if that answered your question, but we are actually working on that with the budget.
This is Abra. So just a reminder, I've gone ahead and unmuted everyone. So if you are able to use your phone's personal mute button when you're not speaking, that would be great, just to minimize background noise.
Anyone have any questions for me for early childhood? Or are you busy thinking about who you can actually partner with? You know, and I think one of the things I want to mention is that, you know, partnering, if you were going to do that, is also local foundations, state foundations, as well as the federal government. You know, we work very closely with national organizations here so that people understand that that home housing has to have services with it. We had on March 30th, we did a congressional briefing, and we had about 60 staffers from the federal government, from a number of different offices, and I will say it was bipartisan. We talked about early childhood homelessness, and the slide actually that has our website actually has some of the testimony from people who actually spoke at that event, and we were able to answer questions. I think that it was staffers who work on putting information for their leaders in making financial decisions, and so we hope that we are contributing to more resources to end homelessness, just as you are.
So, Marsha, I have a question. This is Abra. Earlier in your presentation, you were talking about the different programs that communities across the country are eligible to apply for. And I'm wondering if you can speak to, not to put you on the spot, if HHS or any of the other federal agencies have considered giving point preferences when deciding who to award these to for applications that would include specific mention of partnering with housing authorities.
Well, yes. We actually have those conversations on a regular, yes, we actually do have those conversations. What I will tell you is that the only thing that I can point to that actually shows any success is that when we wrote the preschool development grant a number of years ago. We said that if a state that got a preschool development grant that was going to focus on birth to 5 had to put their McKinney-Vento coordinator on their state advisory council. And we do actually, so that was the lever that we used to get that happening. I know that I know that reviewers look at applications when they come in to look at partnership. We have tried to encourage HUD on a daily basis, actually, to put points in for collaboration with early childhood.
Great. Well, and those are certainly for everyone on the call. CLPHA would, be interested in continuing to pursue with HUD. To keep pushing on that. I mean, I can tell you, Marsha, from the folks on the call, and everyone, please feel free to jump in with more questions or specific experiences. But the folks on the call all do have really robust partnerships in their communities. So I think if that's a way to possibly be able to access additional funding to continue the great work that they're doing, I would assume that that's something that these communities would be interested in.
I think that there is a way to do that. I will tell you that not dealing with the public housing, but dealing with the continuum of care, the Tier 2 information went out recently, and I was bombarded with emails from different states that had lost funds for families. And so we actually had a sit down with HUD to actually learn a little bit more. HUD is very focused on rapid rehousing. How many of you I wonder how many of you work with the rapid rehousing and have spots that you can have homeless families move into. That's one area that I think would be helpful. And I would encourage you all to continue to talk with HUD about the importance of focusing on families, so that, we are breaking the cycle and making sure that children have a place to live. And then we'll try and do our part with the child care and the Head Start and the Early Head Start Child Care Partnership and home visiting. This year I was able to get both home visiting and tribal home visiting to send out letters to their grantees encouraging home visits in shelters and housing authorities. Although that's not part of the law, we were able to actually get some good examples out and have messaging. I think that I have an early childhood development newsletter that we do every month, and every month I have something in there about early childhood homelessness. In fact, I hope in the next couple of months to be adding public housing to my newsletter, to have early childhood programs understand that they too need to partner. I don't actually want to put this all on you. I think it's really important to continue to partner, to be able to find better ways to do the work that we do.
Great. Did anyone want to weigh in on if you or if other staff at the Housing Authority are utilizing rapid rehousing at the moment?
And I think someone wrote a note that said that they lost a lot of funding for homelessness in Wisconsin, and you're right, you did. There's some recent statistics that came out that there were some cities that did really well and some cities that didn't, and a lot of it had to do with the fact that HUD is moving from transitional housing to the rapid rehousing model. But I still don't have early childhood in there. NOFA. I'm working on it.
Hey everyone, this is Cara from King County. I muted myself and I was talking to you guys. No one can hear me. To answer your question about rapid rehousing, I believe that King County Housing Authority is doing that in one of our school districts, a rather large one. the thing is, I'm in the resident services department, and that is just run through a completely different department that I don't have really anything to do with. So with the caveat, like I think we're doing that. And I know Megan's on the call, and she might be able to confirm or deny.
Interesting.
Oh, Megan just emailed me. She says, yes, we are, but I'm on mute to speak up. So yeah, there we go. Woo-hoo. Okay, good. So.
Well, that's good to know, because what I'm trying to do is to find examples of communities that actually are doing rapid rehousing and with families with young children. So if you have any information on that and the fact that you are working on rapid rehousing and young children and I can then tie it to early Head Start and Head Start programs, I think that the more we talk, the more connections that we can continue to make, then that family is going to be much more secure if they have child care if they need it.
Yep, makes sense. The program that we're doing right now is with partnership with school-age children. And I'm honestly not sure if Head Start or Early Head Start or EduCare or any of the many early learning players in that location are looped in. I don't know.
So one thing, when I post the recording of this webinar and Marsha's slides, I also will make sure to include some of the supplementary materials that she discussed. So part of that were some of the contacts for the state leads in this area. Marsha, am I phrasing that correctly?
Yes. No, I actually sent you, I think I gave you the links for Head Start collaboration directors and child care administrators. You all have better access at the local level than I do, but I can give you the, state and federal people. Because I think it's really important that we do it together. The real innovation happens at the local level, and I am eternally grateful to all of you for all the work that you do, because, you teach us and you help us. I'm just very fortunate to have been able to work with people who really care about making sure that early childhood is part of homelessness and housing in local communities. So I thank you.
Marsha?
Yeah. Yes.
This is Maria from Milwaukee. Thank you for sharing your information. I just wanted to sort of toot our horn or HUD's horn for providing choice funding. That's given us an opportunity in Milwaukee to do what you're talking about, really work on collaborations. Yeah. But again, it does take effort and money. And when you talk about, that collaboration, it's not an easy thing. And I think that, everyone is talking about that. That sort of seems to be the trend around the country because we're losing so much money. But it is a difficult thing to do. But we are working with all the schools in the Choice neighborhood. We have gotten everybody on board. But again, it's such an effort on the housing authority's part and all of our partners. It truly is. But I'm glad to report that we are moving forward, looking at early childhood education. It's sort of a cradle to career kind of effort with our families and a neighborhood. So it's really those dollars have really helped us to do that.
Fabulous! I'm excited to hear that, and congratulations on having choice funding. There's probably also some communities that have promised neighborhood funding.
Yeah, that's not one of them. We're working on it.
And I think you're right. I think collaboration it is unbelievably time intensive. But when it's done, I think that what you'll find is that even when the funding disappears to a certain degree, and you may not be able to replenish all of it, you'll have set up a system that will make your community that much stronger.
Yeah. I hope that that's the case. I really do.
Me too.
Great. Well, we're coming up on the end of our time, so are there any final questions? I will also say you don't need to take a decision now, but if you are interested in, I guess, becoming a sub-working group about adapting the toolkit that Marsha mentioned earlier that was created specifically for shelters to be more effective for housing authorities, please let myself or Cassie or Marsha know. If there's interest there, then we can put something together.
Great. And if your housing authority has some space that you use already as, community group space, you may be able to use the tool as it is even.
Mm-hmm.
Abra, thank you for letting me present. Thank you to those who are on the call. I really want to be available to help if there's a way that I can. I don't have all the answers, but I'm certainly happy to try and work through some challenges that you're having. And again, thank you for the work that you do, and I look forward to working with public housing moving forward.
Well, thank you so much, Marsha. Cassie, any final thoughts?
No, thank you so much. I think it was a really great session and just provided some great information, some opportunities for us as housing authorities to think about where is that low-hanging fruit and where can we kind of get started if this is a new area for us. So I think you presented a lot of great avenues for some of us who are maybe newer to this work to be able to find a good inroads. So thank you.
Great.
All right, thanks everyone. As you know, it takes usually 24 to 48 hours for the webinar recording to become available, but I will send out an email alert when it is uploaded and ready for listening and viewing.
Thank you.
Bye-bye.